Hi there. So on March 11th, I got to shadow Andrew Bernard, who is a general surgeon in the new hospital here at UK. And I first started rounding with the physicians when I first got there. And we basically went to every patient's room and we got the nurse or anybody else who was with the patient that night, and we walked in and we talked about if there were any changes that occurred, and we talked about what the plan of care was going to be for that patient that day, and we did that for a couple of hours, and then at around 8 or 8:30 we went down to the OR, and I got to watch a gallbladder removal, which was it was really cool because they went in laparoscopically and they were just like really small incisions. And Andrew Bernard, the surgeon, actually let two residents do it, and he just kind of watched, and he stood with me, and we watched on the monitor, and he described everything that they were doing and like what every function was. And then the surgery only took about like 30 minutes, which I thought it would take a lot longer because the gallbladder was like, it was really enlarged and it was almost like growing into the liver. But so he described like why it did that, and let the residents do that. And then once it was over, the nurses took the patient back up to post-op. And when it comes to the collaboration, the nurses played a major role in taking care of the patient because they brought the patient there, they got them ready, and then they took them back for post-op. And so the surgeons and the physicians and the nurses and the anesthesiologists all worked really well together and very closely together to make sure that the patient had the best care for them. So I really enjoyed my experience, and yeah,